it will be presented by AMDS Karunaratna, Department of Physics and the Faculty of Applied Science. Complications of beta thalassemia major disease. Because of chronic severe anemia, they were having lot of complications throughout their life, bone diseases and bone deformities. And since they are under transfusion therapy, regular transfusion therapy, once or twice a month throughout their life, they are having iron overload. Because of iron toxicity to the organ, they are having cardiac complications, hepatic complications, and damage to the endocrine organs leading to endocrinopathies. And because of mainly due to endocrinopathies, damage to pituitary gland and all, there will be impairment of growth and development and hypothyroidism. And because of their problems, because they have to be hospitalized for a period, and then they have to undergo transfusions. They are facing a lot of psychosocial issues in the society. So these are the main complications coming under beta thalassemia disease. And the management, blood transfusion therapy, and with the transfusion therapy, to maintain the iron overload, to maintain the ferritin levels, they have to be under iron chelation therapy. So they should be under iron chelation therapy. They should be monitored for their iron overload, and at the same time they have to manage their complications into iron overload with psychosocial complications. And as in this study, as we mainly focused on two micronutrients, two trace elements, zinc and copper. So I think it's good to have a little introduction on zinc and copper. And zinc is an essential micronutrient in human nutrition, and certainly the most abundantly distributed micronutrient in human body, and it is having several biochemical roles in our body, including catalytic and regulatory activities of enzymes, protein synthesis, DNA synthesis, cell division, synthesis of family, and thereby modulation of the immunity of the people, and then antioxidant activity. And there were several studies done on zinc deficiency, and they have seen it is related with growth retardation. And copper, again an essential micronutrient, the biochemical role, it is acting as a cofactor for several essential enzymes, strengthening your skin and blood vessels, synthesis of thyroxine hormone, synthesis of hemoglobin and melanin. So you can see how these two micronutrients are essential for our life. So based on these things, we have selected our objectives to evaluate the serum copper and zinc levels in beta thalassemia major patients, and to compare their values with normal healthy individuals, and to find whether they there's any effect on the zinc and copper levels with their physical growth. In her method, the ethical approval of taken from Faculty of Medicine, University of Wageningen, the data collection and the study was performed from 2013 December to 2014 December. And the location, there were two main locations. The chemical analysis was done at Department of Biochemistry, Faculty of Medicine, University of Wageningen, and all the other clinical data, anthropometric measurements, all these things are taken at the pediatric ward teaching hospital, Wageningen. And written informed consent was obtained from all the guardians before the study. Patient recruitment, actually when recruiting the patients, it is convenience-based sampling. The patients aged about 2 years with confirmed diagnosis of beta thalassemia major and who are under any iron chelation regime were selected, and 30 age and sex matched healthy individuals were selected. And exclusion criteria were abnormal liver or renal functions, presence of acute infections at the time of blood collection, because we included this presence of acute infections because it is having some effect on their ferritin level. And ferritin level is the one we use commonly to assess the iron overload in patients. And anthropometric measurements and the data collection, well-validated standardized questionnaire was used to gather data from the patient, and height was measured by using a stadiometer, and the weight was measured without shoes and light clothes using a bathroom body weight scale, and physics scores were taken for both height, and the BMI was calculated, and again the score for BMI was taken because in this study the patients were, the age of the patient ranged from 2 to 20 years, so they were in different age categories. So to increase the accuracy and precision, we have to have the exit score, the generalized. Then then when it comes to collection, storage and processing of blood samples were collected morning, non-fasting state, and 5 ml of blood was drawn and centrifuged, and the serum samples were stored at -60 in acid-washed tubes until analysis. Acid-washed tubes were selected because to eliminate trace elements in the tubes, otherwise it will influence on our results. The chemical analysis, sample preparation 1 to 5 reagent water dilution was used, and then serum and copper levels were measured using graphite furnace atomic absorption spectrophotometry, and serum ferritin levels were analyzed by enzyme-linked immunosorbent assay ELISA kit, commercial kit, and the samples were analyzed in duplicate. Data processing and statistical analysis. The data was stored in Excel sheets, and the comparisons relationships were statistically tested by using independent t-test and Pearson correlation test, and SPSS version 21 was used. The results, we found that serum zinc level in beta thalassemia major patient was significantly low when compared to control group. But both healthy individuals and beta thalassemia major patients, both of them are having zinc deficiency. 80% of patients and 69% of healthy individuals are having hyperzincemia or zinc deficiency. And when it comes to copper, there was no significant difference, and 65% of patients and 56% of healthy individuals, they are having copper deficiency, hypercupria. And here you can see the average levels of serum zinc and copper concentration. Serum zinc patient 44.7, control 63.3. It is significantly different. Serum copper patient 52.7, control 57.7. It is not significant. And at the same time, as these children, they are under continuous blood transfusion therapy, and they were on iron chelation therapy. So we studied whether there is any relationship between between the serum, copper and zinc level with these clinical parameters, but we didn't find any statistically significant relationship with gender, age, duration of blood transfusion volume, mean pre-transfusion hemoglobin concentration, deferricyl dose, that means the iron chelator dose, and the serum ferritin level. There was no statistically significant relationship. And when it comes to the relationship between status of zinc and copper withdrawal status of the patient, there was no statistically significant relationship between height and BMI with the trace element levels again. And discussion, zinc and copper deficiency is common in the studied group of beta thalassemia major patients, and when we go to the literature, micronutrient deficiency is prevalent among the children in Sri Lanka, according to ISRA, and studies were done internationally. Several studies were done regarding zinc levels in beta thalassemia major patients, and they have found they are having low levels. That means these studies match with our study. And the reason for this zinc deficiency in the patient group may be due to disturbances in the zinc metabolism due to their disease condition, renal dysfunction, and high urinary zinc excretion with their iron chelator, because of their iron chelator. And zinc deficiency and copper deficiency studies can be further complicated by some factors like geographical distribution of zinc content in soil, malnutrition, and genetic variation. And there was no significant relationship between physical growth and zinc and copper concentration. And similar studies were done in Iran, and they were also found there was no significant correlation between height and BMI with the serum zinc level. Conclusions and future directions. Hypocynkemia and hypocupremia is common in beta thalassemia major patients. There was no significant correlation between physical growth and zinc and copper levels in our situation, and further studies in trace element level, further studies, multi-center studies with large sample size is recommended, and regular assessment of trace element levels and supplementation will be beneficial in management of beta thalassemia major patients. Thank you. Actually, we draw the samples before the transfusion.
So you know that?
Yes, because all the patients were taken before their transfusion. sometimes, and these symptoms may be masked due to that other complications they are having due to blood transfusions, iron overload, they are having several complications. So we can't separate whether it is happening due to zinc deficiency or whether it is happening due to other problems coming with their disease condition.
Thank you.